Hi, everybody, and welcome to What is This Shift? I'm your host, El Renee, LPN, and this is going to be probably my most intense and difficult episode. However, I think it's going to end up being my most important episode. It's kind of, I have to give some context to why healthcare is a narcissist, right? So I have to kind of explain a little bit narcissism. And, I'm not a psychologist, I'm not a psychiatrist. And while I am considering finishing my degree in psychology, my experience comes through life and exposure and then researching. So, I dare say that people who have been victimized by those with narcissistic personality disorder have a better view of the disorder than those that learn of it in a classroom. But narcissistic personality disorder is not really what I'm talking about. But just for some reference, the DSM-V, which is used by psychiatry to diagnose, but also to explain the different types of psychological things that happen to human beings, right? The disorders, the mental illnesses, all of the things that we know currently about the way our brains work and the way psychology works can be found in this book that's updated often. And within this book, there are something called personality disorders or dysfunctions. And that is different than known mental illnesses. That basically the difference is that the mental illnesses can be treated and they're known to be genetic or organic in nature, whereas nobody's really clear on how personality disorders are formed. This is still a relatively new area, right? But what is known is that they're put into clusters. There's cluster A, cluster B, cluster C. The ones getting all the attention right now are the cluster B personality disorders. These are the ones that you're going to find psychopathy, which is psychopaths. You're going to find sociopaths, which is now falls under the heading of antisocial personality disorder. There is borderline personality disorder, and research has shown that that is typically induced by having been abused by people with cluster B personality disorders. And then you have narcissistic personality disorder. This is basically the cluster of people that are going to abuse you or unalive you, right? These are the bad folks. And it gets confusing because a lot of people want to give them grace and think that they can be treated with enough hugs and enough therapy, yada yada. I'm a firm believer that these people are typically born this way. I do believe that they will find someday that there is a genetic component. It tends to seem like it runs in family, like generational trauma does seem to, and I mean, you could argue, well, if you're abused, you're going to grow up and be an abuser. That's not necessarily true. But there does seem to be, it does seem to run in families. Nature versus nurture is the argument many folks are having right now. Regardless, this is what we're dealing with. Like when it comes to good versus evil, the hallmark of every single one of these disorders is a lack of empathy or zero empathy to their fellow human beings, and a complete self-absorption, and it's, self-centeredness gone amok, running amok, right? That at the end of the day, everything is self-serving. Now, to be fair, it's known that every single one of us on the planet has some degrees of narcissism, in the sense that we are, interested in our own self-preservation, and we have to have that in order to survive being on this rock, right? Like you cannot not have that. So a healthy degree of narcissism is necessary to, get through your life. It's when it gets disordered or dysfunctional that it starts causing problems. So within this group of people, there are certain symptoms that they have and certain things that they do and ways that they navigate through life and their interactions and their interpersonal relationships with people that are uncannily similar, meaning that it's kind of like when I mentioned diabetes, that it doesn't matter what walk of life you're from or your age or anything. If you have diabetes, you're going to have the same set of symptoms as the next person that has diabetes. It's the same is true with cluster B people. They share the same symptoms. They do the same things. So when you get online and you're, say, in a support group for victims of narcissistic abuse or any sort of abuse, you're going to find people talking about what they experienced, and they all have shared experiences because these people do the same things, they say the same things, they have the same MO, and you can literally bullet point how the interaction goes. So how is it that an entire system could be narcissistic or be a disordered evil person, right? It's a system. Healthcare is a group of people. It's an entity. It's a corporation. You know, they say corporations aren't people. No, they're made up of people. But how can an overall, on a macro level, how can narcissism exist? Well, if you understand the micro level and the interpersonal relationships, you're going to understand how it works in the healthcare system. And when you see that correlation, it's like your eyes are wide open. You're like, damn. And I think it's super, super important to understand what's happening with us and the relationship that we're in order to break free of it and to change it. We are trauma bonded to the system because of the very reasons an individual will stay trauma bonded to an abuser. When they ask, when people ask, why do women go back to a man that has been physically abusive? It's the trauma bond. And it's very complicated. And that's why this episode, it's like, I can't really get into all of that, but I can definitely encourage you to, see the correlations. And I'm going to explain that, I just kind of needed this primer to get into it first. And I do want to put a trigger warning as well, because unfortunately many of us in healthcare have been in abusive relationships, or we have been traumatized in our past, or even currently. Unfortunately, I do work with nurses who are in questionable relationships and who are being controlled, and it's, what can you do until that person reaches out and says, I really need help getting out of this? So I've seen it on the job, and I've seen it in my own personal life. This field tends to attract either one or the other. It either attracts people who are highly empathetic and have compassion, who have been traumatized and have decided that they want to help other people. They want other people to avoid what they've been through, whether it's physical, mental, emotional, spiritual. They're very the victims are typically very attracted to the healing arts in some way, where they want to give back to the community, and they don't want their own pain to be in vain, and they want to help other people avoid it and to have higher quality of lives, right? And to not be hurt. Conversely, you have the people doing the hurting that are attracted to this field. I'll never forget, it was my first day in EMS class because I was an ER tech, so I was getting my EMT. And the instructor literally stood at the podium and said, yeah, this field attracts a lot of sociopaths. And I was like, damn. Okay. And this was sort of before I really had any sort of knowledge behind, what narcissism was, what sociopathy was. I didn't know what, I just knew that there were folks I was working with that were crazy. The label was they're crazy, they're psycho, they're nuts. I didn't know. In fact, it was 2009 when I was Googling and binging my way through trying to figure out what brand of crazy I was dealing with in a personal relationship. And that's when I stumbled upon narcissism, and I fell down the rabbit hole, and I've been fascinated with it ever since. And the different forms that it takes. There's overt narcissism, where it's classic symptoms of like an overt obvious almost. And then there's covert, which is way more sinister and way less obvious to people and way more damaging as a result. But both of these folks wear masks. So what they present to the outside world is very different than what people who are intimate with them and close behind closed doors with them experience. But there's different methods that they use, or they use the same methods, but the way that they entice people, attract people, and then keep people involved with them, it's very it's complicated, right? But people have been starting to break it down, because the more people have shared, through the advent of the internet and people being global and people opening up because of the anonymity often of the internet, more and more people have come forward and said, I'm experiencing this, or this is going on. And so it seems to have exploded with this awareness almost overnight, with people sharing their stories about narcissism and abusive relationships. Whether it is romantic, family, parents, your coworkers, a boss, on some level, we've all interacted with someone who has a personality disorder. And at the end of the day, it's really not important which particular disorder it is, which diagnosis they would be given in a professional setting. What's important is recognizing the symptoms of someone who has these disorders and dealing with them accordingly and protecting yourself from them, which is easier said than done, because they can fool a lot of people. That is probably one of the biggest traits that they all share, is that they're often very charismatic, attractive, magnetic. They like to mirror people, so you feel so seen, you feel so understood. They love bomb. They make you feel so good in the beginning. That dopamine rush is like nothing else. And that's how they suck you in. And then how they treat you within the relationship, it's something else. Okay. So without getting any further into that, how does that translate into what I'm trying to talk about here? Because I'm saying that the entire healthcare system is a narcissist, and that's a pretty big, bold statement to make, right? Like, who the hell am I to say that? Again, you should never diagnose an individual human being unless you are their therapist, right? It's unethical. Just like me as a nurse, I can't diagnose someone's physical illness, but I can certainly let a physician know, hey, these are the subjective and the objective observations of this person's symptoms. Here's this data. Now you make the call, right? And that's typically how it goes. But as I'm giving that data, I can in my head go, I know that they probably had pneumonia, but I can't diagnose that. I can only say, well, they're coughing, they have a fever, So it's the same thing. You can't physically or you can't ethically diagnose people if you are not their therapist, but you have a really good idea if somebody is rocking some sort of disorder, right? So now, how does that translate to healthcare being a narcissist? If you understand the different symptoms of, and I'm saying narcissist as a blanket thing. They could be a psychopath. They could be a sociopath. It doesn't matter. All of those traits have narcissism within them. So that's why I'm saying a narcissist. And because it is a catchphrase that most people have had some awareness of, again, unless they've been living under a rock. So when I say healthcare is a narcissist, what am I saying? Well, let me ask you something. What if healthcare wasn't broken? Like, what if it was behaving exactly the way it was originally designed to behave? And what if you really looked at it, healthcare didn't act like a system at all, but what if it acted like an actual individual narcissist? So think about that, because all narcissists care about their image, their reputation, how they appear to other people. They want everybody to like them. They want everybody to think that they're great. They want everybody to pat them on the back, give them attaboys. They want to be seen and perceived in a very positive light. And they will do many different things to get that, what they call supply, to be supplied with that constant adoration, at being admired, being, the best in the room, right? Now, the overt types are very arrogant and very full of themselves and very egotistical. Covert types are as well, but it's much more low-key. It's much more subtle. But at the end of the day, everybody with these disorders have a mask. They are presenting a front, a facade. Every day is like an Instagram post, right? But behind closed doors, that ain't the truth at all. So a narcissist cares about their image, and they control the narrative. They control the narrative of, what's happening in their relationships, what's happening in their lives. They blame shift, right? They shift blame. They're never at fault, they are never the problem. And if they're found to be doing something that's going to mar their image or their reputation or make them wrong in some capacity, they will never take accountability or ownership. They'll always blame it on other people. At the same time, they demand loyalty, right? They're the ones that are going to be cheating all the time, but you better stay true. And they demand all this loyalty, but giving very little back. They breadcrumb. They give you just enough to keep you hooked, with the promise of giving you a lot more in the future. But it never materializes. So does that sound familiar to like your workplace? Because healthcare loves a good image, especially now that it's so competitive, because everybody's insurance, PPOs, people have choices now. You used to just go to your local hospital and whatever MD was in your town. Now you can go cross town, you can go out of state even, and these places advertise that. So, every nursing home, every hospital, but I'm long-term care focused, so every nursing home, every assisted living, patient-centered care, resident-centered care. We're all about compassion. We're all about dignity. We're giving you home-like environments. Everybody's got a mission statement. Every corporation has a creed, a promise, and it's all, about integrity and respect and compassion and love and all that kumbaya stuff. Because it's beautiful. It sells. It reassures families. It reassures the residents. It gives a sense of like, we care about you. We adore you. And we're going to treat you like you're our own. But if you're the one actually working inside those buildings and in that system, the truth is a lot messier. Because behind that polished image is actually higher acuity patients. You have fewer staff. You don't have the type of staff that's promised, and sales and marketing will sell people on a lot of stuff that isn't even true. Like, oh yeah, we've got people that will come clean the rooms and do this and do that. But they fail to mention that the resident's going to have to supply their own garbage bags, their own cleaning, or that it's only once a month they come in. It's not like a hotel where they're coming in, every day and changing the linens. there's less support and more responsibility that's actually pushed downwards. So the selling points are not necessarily reality. And they didn't make the care safer. They're not doing these things often, but they made it look like they are, right? They if you especially look at assisted livings, if you go on the different various websites for the various different companies, they sell themselves as resort-like living. Like you're literally in a hotel. Every day is a spa experience. And that, we know that that's not necessarily true. Okay. What does healthcare system do? They gaslight the staff. And here's where this starts to mess with your head, because you're standing there thinking, you know what, this doesn't feel right, because something's off. Like the workload is too much. The acuity level of people getting admitted is not appropriate. The expectations of what we're supposed to tolerate is like, this is not right. And what does the system say? They'll tell you, no, this is appropriate. This is okay. This is within the scope. It's okay to have this here. And yet, you know, it's not okay. For example, you know, you get an admission to a memory care, but the person is clearly Jerry Psych, and they're not being treated appropriately, and they're very difficult to handle, and we don't have enough staffing. We don't have, you know, the proper involvement with folks that can assess this correctly. And this person keeps trying to elope, and they keep trying to get out of the building. And so you've been telling people and screaming into an abyss, and a month later that person gets out of the building and is found on, you know, a highway walking down this road, and thankfully they're okay. But you've been saying for a month, ever since that person was admitted, screaming through the doors, fuck you, that this may not be an appropriate place for them. And yet it's like, what do you have to do to be heard and to be seen? Because it takes almost tragedy to get anybody to listen. And what it takes is the threat of litigation or getting their image marred. Because nobody seemed to care that this person kept getting out of the unit every single day, and that they kept pushing the door and the alarm was going off on a constant basis. They didn't care. The staff, both the nurses, the caregivers, everybody is documenting on this. They're reporting it to their management, who's just throwing up their hands like, it's, you know, we don't know. It's out of our hands. Like, whose hands is it in? We don't know. And nothing's done until that person actually got out of the building. And could you imagine the bad press, right? The bad optic. Oh, this person got out of the building. Let's say that person got hit by a car. Well, now it's going to be all over the place, because it's going to be reported. It's going to be in the news, and then it's going to be all over Facebook groups of, don't put your loved one in that community because they had some. It's going to be a big deal. Other, you know, facilities are going to use you as an example to their staff of what not to do, or this could happen. So it's all about image and appearances and litigation. That's when they started to care, keeping that mask intact. And so you're being gaslit because you already knew that this was okay. Not okay, but they're telling you it's okay. Just because they had some sort of diagnosis of dementia, right? That wasn't even from a full, you know, mental evaluation, but just from like their PCP. So you're questioning yourself, and you're questioning like, okay, am I out of line in thinking that this wasn't okay, even though you know internally it's not okay. But these decisions are made way above your pay grade. Policies, admissions, and it doesn't matter that it was, you know, maybe sales and marketing that went on that assessment and said that they were okay to come into the building. Basically, a non-clinical person made that judgment call. You know that doesn't seem right, but they're telling you, no, it's okay. So admissions and staffing ratios and care models, all of these things, you don't have a say in any of that, and your voice isn't heard. And sometimes even the manager's voices aren't heard, because a director of nursing will go on an assessment and say, I don't think this person, fits the criteria, or they're not appropriate. And somebody way above them on the corporate level will override it and let the person move in anyway, right? That's gaslighting. But then when something goes wrong, guess who gets looked at first? Not them, not the system, but you. What could you have done better? Like in that situation of the resident who got out of the building. Did you assess them? Like, did you attend to their needs? Did you document? Did you follow the protocol? Why wasn't anybody aware of the fact that this person slipped out? You were being negligent. You weren't keeping your eye on them. Even though that person slipped out while the only two caregivers were, assisting people in bed, and the only nurse was in the middle of a medication pass in an area where there's a TV blasting and you couldn't even hear the alarm, and nobody reported the alarm going off. So there was a lack of staff, and there was a lack of being informed. It was a system failure. It was a setup for failure. But yet ultimately, that nurse now has a license that's been threatened, and the caregivers are also facing, we are now getting criminally indicted for things. So we're all facing the wrath. And do you think that the company is going to have our backs? Are they going to support us on that? No. So we're now responsible for outcomes that we had no real control over. That's not the company taking accountability. That's blame shifting. That's something narcissists always do. It's never their fault. It's always the victim's fault. Okay, boundary violations. Narcissists are big on that. Violating your boundaries. You set down a boundary, you say no. You say, I'm not comfortable with this. I don't feel right about that. They don't care. They do not care, because they are about themselves. And sometimes they actually like to cross your boundaries to see if you'll push back. Because if you don't, then they know that they can walk all over you, right? So let's say, for example, an assisted living is supposed to be an assisted living. It's not supposed to be a mini skilled nursing home. A nursing home is not supposed to be step down med surge or an LTAC. But what happened? We started layering complex medication regimens, people on oxygen coming in the door on oxygen to an assisted living, behavioral managements like the undiagnosed, psychiatric issues, like in somebody in a memory care. Immediately they get diagnosed, they have a complex medical situation. They immediately get admitted, and hospice shows up an hour later to admit them. See, especially in an assisted living or a memory care, the criteria for memory care isn't a diagnosis of dementia that is supported by heavy documentation. For assisted living, which is not legally supposed to be a medical facility, the criteria is that you don't have a medical issue that needs to be managed by nursing, by skilled nursing. You can have high blood pressure, you can have a prior history of something, but you don't need nursing care. You need help with your activities of daily living. Assisted living, help with your laundry, help with cooking, help with cleaning, help with, being reminded to take your medications, but you're fully aware of what your medications are and why you take them. That is the classic assisted living setting. And then as you live there, and as a couple of years may pass, maybe you do fall. Maybe you did end up having a stroke. Now you do need more complex care. And it's called aging in place. That means you don't have to move out just because you have developed more complex needs. Now the assisted living can work with home health, work with hospice in order to keep you in your home. But what we're seeing is people who automatically need that type of care being admitted and then quickly being thrown onto hospice or home health as the loophole to keep them. And we're being gaslit into believing that, no, that's okay, and that it's not a loophole. But it is a loophole. The criteria for hospice is supposed to be a diagnosis of like a terminal illness where you are expected to die within the next 6 months. I've seen people on hospice be recertified and stay on it for 5 years. So we've started doing all this and all into environments that were never designed for these levels of care. And did the staffing increase as a result of this? No. Did our resources to deal with it increase? No. The expectations sure did increase, but the support didn't. And that's a boundary violation. So then if you try to speak up about this, you're silenced and sometimes retaliated. Just like in real situations outside of work, in your real personal life, dealing with disordered people on a one-on-one basis, if you try to expose them or if you threaten to expose their behaviors, like I'm going to tell everybody how you're treating me, I'm going to call your mom type of thing, what happens? You get labeled as being the problem. You're the one that's the issue. So it seems that it's an unspoken, knowledgeable thing in long-term care. It's like everybody knows it, but nobody's really speaking out on it. But it's kind of well known that if you talk about the problems, you become the problem. You are labeled the problem. You get labeled difficult. You get labeled not being a team player, or you get labeled as you're negative. You're not for the team. You don't have the spirit, like the rah-rah, kumbaya spirit. You're not following core values, you're problematic. You're the issue, not what you're speaking on. So you get sidelined. You get excluded. You start getting the shittier assignments. You get moved around. Your schedule starts getting messed with. You stop getting opportunities. And sometimes you're just gone. They straight up start targeting you for termination. And they find reason. And sometimes they don't even need a reason, and they'll tell you without cause. But because it's an at will, they feel that they can get rid of you. So the squeaky wheel does not get the oil in these situations. The squeaky wheel gets tossed because we can't be having anybody that's going to be exposing us, right? Because we need people to stay complicit and put up with our abuse. The message is clear. You need to keep your head down. Just come to work, do your job, shut up, go home, period. Because in healthcare, speaking up doesn't always get you heard. Sometimes it gets you erased and blacklisted, because many of these places own 50 other places in the area. So if you're with company Shady Acres, Inc., and they own 20 facilities in and around your area where you live, you can't go to any of them. So you've now excluded 30 different places near your home that you can live because they're all under that one umbrella, and they've listed you as like not rehireable. And it doesn't matter if you're in the right. That's what they've put. So now it's like, well, you're not eligible for rehire, even though you were advocating for the right thing. So you're listed as the crazy one. You're listed as the problem. You're the reason why they're having a hard time, because they have to deal with employees like you, right? But there's some intermittent reinforcement, which is what narcissistic people will do in personal relationships. They give you just enough love that keeps you there. It's kind of like if you were to starve somebody and deprive them food, but then you suddenly throw them a bag of Cheetos, you are invoking Stockholm syndrome in somebody. Like suddenly they're going to see you as like the hero because, oh look, they're giving me food, but it's a bag of Cheetos. And like Cheetos are okay, but they're not sustenance, they're not nutritious. But you're going to eat that bag of Cheetos because you haven't had any food, and that's going to be the most delicious thing you've ever had in your entire life. You're like, oh my God, these are so good. They're not. You just think they are because you've been so deprived of food and sustenance that like you'll take it and it's going to be amazing to you. Whereas if you were in a normal, healthy situation and your appetite has been satiated, and you have many options available as to what you'd like to eat when you start getting a little hungry, you're not picking the Cheetos. It's the same thing. So this is the intermittent reinforcement that healthcare gives you, that you start thinking, oh, this is okay. So when you are being told, oh, you guys are great, here's some pizza, after being treated so shittily and being so ignored and being so sidelined and being constantly berated and told everything you're doing that's bad or not right or threatening you. I literally worked at an assisted living that threatened the nurses and said, yeah, our state just made it so we can start having medication technicians. So you nurses better look out or your days are numbered because we're just going to replace you. Oh, okay, right? So sometimes they blatantly just abuse, but not every shift is bad. And sometimes you get that intermittent, like, yeah, you're replaceable, but here's a pizza. Some of the shifts are smooth. Some of the patients are stable. Sometimes you end up working with a manager that's amazing. Some days feel manageable, so just enough to make you start questioning yourself and thinking, okay, maybe it's not that bad. Maybe I'm just at a bad facility. So you quit and you go to another one. And maybe you've done this enough times like myself that you start realizing, nah, it's not me. It's the system. But if you don't do that, you don't know that. So you stay in the same place and you think, okay, maybe it's just me. Maybe my expectations are too high. Like you start doubting yourself. Just like after you've been hit a couple of times by somebody and they tell you it's because you made them do it, you start wondering, maybe I did. Maybe it is me. But then the next shift hits you and it's a shit show and it's chaos again. That level of unpredictability is how people stay in these unhealthy jobs because they keep doubting whether they're correct. They keep getting judged and ostracized for questioning it. When they try to stand up for themselves, they are belittled. And so they just keep their head down, go with it, because they don't realize that they are literally in an abusive relationship. Like, here's a real world snapshot of that. Let's say you have a resident with complex meds, changing needs, they have layered care, and during the day, decisions get made. But then at night, let's say this is an assisted living. There's no nurse. Just young caregivers that have a cell phone and are given a protocol that if the person is having a problem in their hospice, you call the hospice company. If not, you just call 911. And that's not knocking the caregivers. I mean, a lot of times these are 17-year-old kids, right? They're just doing what they're told. But understand that at 2 a.m., the system isn't there for them. It's not there for the residents. It's not there for anybody. It's there for their bottom line because they don't have to pay a nurse to be there. And according to the legal standards of assisted living, they don't have to provide nursing, period. They do it as an amenity. They do it as a service that they offer, but it's not required legally. So they don't have to have a night nurse. And as long as they tell the families up front, this is the thing, and we do have a nurse that's within a 30-mile radius, so they can get here, or I think you have to be there within 30 minutes. So we can get a nurse here in 30 minutes. And as long as the families are aware of that and they consent to that by signing papers or whatever, it's considered okay. It's okay. But we know it's really not okay. And if we say something, though, we're a problem. We're not fitting in. We, are too negative. We have too much of an attitude. So, we've made all this more complicated without giving the people at the bedside the power, the time, or the resources to safely manage the expectations of what's being asked of us. I could go on and on with the different examples of how dealing with a narcissist in your personal life coincides with dealing with the healthcare system as a whole as a narcissist. I'm often on the internet looking at what other people are saying in healthcare, many different groups. And I found one that it was a pretty good example of this, okay? I'm going to paraphrase it so it's not completely calling attention to, well, you guys wouldn't know. Internet's pretty big. But again, everything that I say here is my opinion and my opinion only, and I'm not disclosing anybody's names, breaking HIPAA, none of that stuff. So there was a nurse who was working a second shift, 3 to 11, when something tragically happened to one of her immediate relatives unexpectedly. So she called in at about 11 a.m. So 11, 12, 1, 2, 3. So like a 4-hour notice that she wasn't going to be able to come in for her shift. Prior to this, she was one of those really reliable employees. She never called off. She was always on time, like never gave the company any problems. She was very reliable. But this tragedy happened and she's calling off as an emergency call off. And the director of nursing gave her a lot of shit. And gave her a lot of shit for, not calling in soon enough. And, this is not acceptable, blah, blah, blah. Okay, she did call in. First of all, okay, you have to call in at least 3 hours before your shift ends. That might work if you're home with like flu-like symptoms, right? But if you suddenly start throwing up 15 minutes before you're supposed to leave your house, or somebody drops dead unexpectedly, like you can't always call in with that, within that time parameter. Now, I understand the nature of what we do. It's not like an office job where if you don't show up, nobody's affected, right? Except you, because the next day you come in and you have more work on your plate. But in this environment, I understand that, you have to have a replacement. However, that type of thing should really be factored in. And it is, because this facility actually utilizes agency nurses through one of the apps. I don't remember if it was Clipboard or Shift Key or whatever. So they had a contingency plan because God forbid some of these nurse managers would get on the floor, right? Especially for a nurse that has been loyal. And it goes back to the expectation of loyalty and not giving anything back. So she could have put out on these apps, premium shift, because I've seen that a million times when I've done agency. They have a last minute call off and they need coverage ASAP. Yeah, they pay a little bit more, but at least the DON doesn't have to be on the floor, right? So they have a backup plan in the event of this. So this nurse went on to describe just how badly she was treated and how she was berated and how she was made to feel like shit because, her loved one dropped dead. And she came to the group online and looking for advice because she was totally gaslit, right? She's like, I don't know. Am I in the wrong? She's asking, like, I feel terrible. And she literally said, I know I was wrong because I called in late and it's really difficult to find coverage, but it's not like I could help it. Okay, that's giving a woman that just got hit in the face. I know it was my fault because I provoked him, because I told him I should have waited until he had, sat down from work and relaxed a little bit before I told him that, our son is sick. You know what I'm saying? Like, something she did that was totally reasonable, and she gets hit, and now she's apologizing and she's claiming that she's wrong and that she understands it's her fault that she got hit. That's exactly what this nurse was saying. Like, I know it's my fault for calling in late, but I don't know. Like, it was the saddest post I think I've seen in a long time, but it definitely illustrates what I'm saying in this episode, which is, how in the hell are you at fault? In no way are you at fault. And I basically said, I commented under that as like, the first thing you need to do is delete that sentence from this post, because you are not at fault. You did not call in late, and it doesn't even matter. Even if you did, I don't care if you called in at 2:55 p.m. Oh, well, that DON can take the keys until they find a replacement. And you know what? Money talks. You offer somebody a little bit of OT or a little bit of a bonus, or you get on the shift key and you say premium. Yeah, it costs more, but we know you got the money. Take care of your staff. Be there for your staff. Show the same compassion and empathy that you have on your little posters that you like to, let the community see about your value system. Be that value system. So not only was I so angered and incensed, and so was 495 other commenters, okay, that's exactly the type of shit we're dealing with out here. Being treated that way. Now, do I have a million other examples of how healthcare workers are treated on the job and how we are systematically being abused? Absolutely, I do. Can I cram them all into this episode? I cannot. But next episode, I'm going to talk about the relationship that we have with each other. Okay? Say nurse to CNA, which is a classic pairing. And together, when a nurse and a CNA are on the same page and they are a team, we save lives consistently. When we are at odds, not only does it create a hostile work environment and toxic workplace, but people die. But yet, when there's the bad juju between us, when there's the dark energy between us, the system thrives on that. They want us divided. Narcissists are really good at triangulation like that too. Perfect example is, there's a man, he's in a relationship, he's cheating on that person. The two women start going at it. They start blaming each other. They start hating each other. They start, going after each other. And he's just sitting there getting off on it. And both of the women are still catering to him. We see that classic all the time. That triangular shit all the time. The healthcare system does the same thing when it comes to the nurses and the CNAs going at it. So I'm going to talk about that next episode. I may revisit this subject in future episodes and kind of do a part 2 or even a part 3, because it's that important that we start waking up to the fact that we are being narcissistically abused on the same way, or the same level, in the same way that one in our personal lives may do. The healthcare system lies. Narcissists lie. Tons of lies are being told. And if you try to expose those lies, you're discredited. Just like you're blackballed when you get fired. Person's not rehireable. Why? You were actually advocating to do the right thing. I would want somebody on my team that cared enough to speak out, but nope. Narcissists are huge on smear campaigns. That's why if someone does speak out, their reputation is immediately, questioned and exposed. So there's a lot of ways in which nurses and RNs have experienced this quite a bit, and you see it in the news even, like this stuff makes media. Even physicians who have spoken out. This is not just, LPNs in a nursing home. This is pretty much any whistleblower in healthcare has experienced blowback. for the same reason that a narcissist will do that to you if you try to expose their abuses. And they're full of denial. Deny, deny, deny. That's why I say document, document, document. Because it's true. If it's not documented, it didn't happen. Always cover your ass. I don't care how outlandish your documentation seems or how petty it is or how stupid it is. I don't care if somebody farts. Document it. So for now, I'm going to leave this episode at that. I hope you will stay with me. We have plenty of more important things to discuss. I do have plans to have a guest speaker who has a PhD, and her thesis and her area of expertise is nurse bullying, which kind of plays into the relationship that we have with each other and how the healthcare system has fostered this and has encouraged this negativity and this triangulation. So I hope to have her on soon, but I kind of wanted to establish this podcast a little bit. So please share it. Please, I don't care if you like it or not. I'm not looking to be popular. I'm just looking to have the word spread, because I'm just one of many that are trying to get the message out. So please help us get that message out. If you have experience and you've dealt with narcissism in your personal life and you are awake and you're woke. I know people hate that word. I don't care. If you are woke to how it's the same shit happening on your job, please reach out to me and I'll have you on the podcast as well. Because I think if we understand the type of relationship we're in and we break that trauma bond and we get the Stockholm syndrome out of the way, like, we can actually start healing and we can actually start banding together, healing the relationship we have with each other, and stand up to this. Because this abuse needs to end, because ultimately the general public is being abused by proxy as a result of it. And let's not pretend that the healthcare system isn't okay with the general public treating us like crap, because if they were okay with it, nurse violence in hospital settings in particular would not be a thing. So that being said, if I'm targeted for termination, you'll know why. It'll be this episode, I'm sure. But thank you so much again for all your support. And like, share, comment, do all the things. Thanks so much and have a blessed day.